Yeah. That was offline though, so.
No, you're fine.
So your address is not online.
It's live stream.
Yeah. Now you're live again. It's dropped. This must be a dropout point as well. So.
Oh, well, there's something you can work on.
Yeah.
Getting more
mobile phone communication sales. Unfortunately, that's federal, but
Yeah.
But anyway, I can advocate at least.
That's exactly right. Yeah.
You're a Brisbane Lions fan, eh? Or you were Fitzroy originally?
Born and bred in Fitzroy.
Oh, okay. Yeah.
Yeah, so I just keep following them. And,
Yeah.
Had a good run.
Yes.
Yeah, a lot better than the old Fitzroy days.
Oh yeah. You've had a good run recently. So.
Yeah. Oh well, we won one flag, so that's as good as any.
Exactly. Oh, you heading off? Do you want to stay for this little spiel that we're doing right now?
That's got to go.
Oh.
I've got an appointment, but I'll try to come back.
No worries, mate. Thanks for coming down. Thanks for walking with us for a bit. So.
Try to catch you all.
Yeah. Thanks, Steph.
Thank you.
Nice to meet you.
Good to see you.
All the best. And
you too.
well done. Good luck with your. Oh, there we go, Shaq. There we go. Well done in year 2 at Mount Eliza North. So I'm sure you'll continue to do great. So hope the hot chocolate was good.
Oh yeah,
Yep.
He loves his sugar.
Yes.
All right.
All right.
Chris, what do you think?
Yeah, I think this is a good time. And then
Good. Thank you for coming.
thanks.
So,
All right.
Welcome everyone. I don't think we need this microphone.
Let's use it
However,
anyway.
It's actually great. Just hello, welcome.
Hello. How are you? Is it Sarah? Yes. Sarah, how are you?
Sarah, sorry. We'll
We're just about to start.
Nice to meet you.
Chris, nice to meet you. Going well? And
Silvio,
nice to meet you. SS. There you go.
SS, nice
You covered it, yeah. So is my sister's Sarah and her husband Simon, so covered it. Yeah, it makes it easier. Yeah. Exactly. Very good.
I'm just going to I'm going to introduce Jess.
I just posted that on my page.
Oh, thank you. Very kind of you.
Said come down.
Yes.
Before 11:30.
Oh yeah. Well, we're still here until 11:30, so.
Whether they'll see it or not.
Yeah.
Facebook and its algorithms.
I got 10 minutes
you're
to get
tagged on it, so hopefully they'll see it because you're on it.
Thank you. Appreciate it.
That's all right.
Now, I think. Thanks for coming down. So, yeah, got a family affair. So,
Family affair. Everyone's on board.
Yes, including the dogs.
Okay.
Working there.
Okay, we're back again. So, Chris, welcome. Here we are at Mornington Park.
Yes.
How many kilometres are you into your walk?
That's a really good question. We're 11.4 kilometres.
11.4, only
10 to go. So we're actually more than halfway now.
10 to go. So well done. And it's the day before the start of Bowel Cancer Awareness Month.
Yes.
Which is tomorrow. And not only are you live streaming and highlighting the benefits of your beautiful electorate and showing everyone the coast, you're supporting such a great cause for Bowel Cancer Australia. As an ambassador, a bowel cancer survivor myself, I do have to declare I am working in your office as your Chief of Staff, but I'm so grateful for you supporting Bowel Cancer Australia. As we know, it's just a hideous disease. It is preventable, it's treatable, and it's beatable if it's caught early. So the more we do talk about this, it's not a sexy topic, the better. So yes. I'll hand over to you to say a few words, and then we're actually going to introduce a lovely lady, Jess, who's going to share a story about Dean, who was affected by early onset cancer, bowel cancer as well. So I'll hand over to you.
Thank you. Well, firstly, thank you everyone for coming along to Mornington Park this morning, including my family here, my daughter Yasmin and my son Eddie. Thank you to everyone who's joined for this walk in whole or in part. Who's donated so far and who's helped to raise awareness. In particular, Donna. So Donna Hope, she's not only my Chief of Staff, she's the ambassador for, one of the ambassadors for Bowel Cancer Australia. Donna is a bowel cancer survivor herself, 10 years clear now, but she's really keen on raising awareness, funds, but also trying to prevent bowel cancer and ensure we get treatment early and we get testing early as well, because it's impacting more and more young Victorians, young Australians, and I guess young people globally as well. So it's really important to get yourself tested. So today we're doing a 21 kilometre coastal walk. or coastal trek, I should say, because we've gone in a bit of water or on rocks and on paths. From the top of Mount Eliza, or Kakaraboit Creek. We started at 7 a.m. this morning, and we aim to finish at the beach near Alarina Road in Mount Martha by 5 o'clock today. We've done 11.4 kilometres so far, and we estimate it's about 21 kilometres in total, but we'll find out from Runkeeper what the exact amount is by the end. But I'd like to thank each and every one of you for coming today to support this event. You're all very much appreciated. Some of you will have personal experiences with bowel cancer, either yourselves or in your families. But many of us know someone as well who does have bowel cancer. So it is important to support the cause. If you can donate today, you can go to bit.ly, which is bit.ly/Chris Walk. It's in the Facebook link in the live feed, and you can watch and donate. Even $5 can really make a difference. But without further ado, we do have survivors here today and people who are family members of both people who have bowel cancer and who have unfortunately passed on from bowel cancer as well. And we want to introduce Jess now, who will tell her story and the story of Dean. Thank you, Jess.
Thank you, and thank you so much for doing this. I've got my little pic of Dean here. Oh, thanks.
There we go.
Puppies. Yeah, so Dean was he was 35 when he was diagnosed. Very little symptoms, but when he did show symptoms, we were very lucky that our GP was on the ball, sent him off for tests, and by the time we got through those couple of days of tests, that was stage 4 already at the age of 35. So they started pretty quick on him, and we're lucky in this country to have a healthcare system that allows us to do that. But after sort of close to 70 rounds of chemo and 40 rounds of radiation, a couple of clinical trials, and COVID in between, unfortunately, Dean passed away in 2022. So we're coming up to 3 years now, at the age of 38, which is too young. No one should be losing their lives to bowel cancer or any cancer really. But yeah, Dean was a huge advocate. He was a musician, first and foremost, a wonderful trumpet player, a Peninsula local, and his thing was to make connections with others. And I think my job now is to continue on that legacy and do things like this, and to thank people for raising awareness, ask people to get tested, and say to those, if something's not right, push for your own healthcare and your own advocacy. There is a lot that we can do. It's a disease that, like you said, if we catch it early enough, you have a good chance, but it's catching it early.
That's right.
So, for us, lowering the age of that screening, we're down to 40. I think we can get that lower even, and asking people to go get a colonoscopy, and for a couple of days of unpleasantness, it can go ahead and save your life. But the community of people around us, and especially during those COVID years, you just connect with people on social media, and I carry around a piece of paper of those friends that we met along the way that aren't with us anymore, or spouses, kids. They themselves are parents, their sons and daughters, and I'm really lucky to have the wonderful support network. My parents are here, Dean's parents are here. Everybody understands that this is a really important thing that we can do. There's a lot that we can do, and we thank you today, Chris, for really just spreading the message. And it's a lovely community, the Mornington Peninsula, so we thank you for doing what you're doing, and thank you, Donna, for having us.
Thank you, Jess. Thank you, Jess. I'll hand back to you in a moment, Chris, but I just wanted to mention also, as an ambassador for Bowel Cancer Australia, thank you so much for having the strength to share Dean's story. Dean was absolutely too young, and as you mentioned, the bowel test kits the government are sending out, they're fantastic, but if you're in your 30s, it's not going to make a difference, because at the moment, if you're 45, you need to, access a kit, but in saying that, there are the symptoms. If anyone's experiencing symptoms, I ignored my symptoms for 9 months, as my mum will testify to. And I'm so fortunate that I won my battle, that you're sharing an incredible story, and Dean, I imagine, would be very, very proud of you for sharing that. But we do lose 101 Australians every week to this. Over 14,000 Australians are diagnosed every year, and it's through, if anyone's been watching the news this week, we have the highest levels of early onset bowel cancer in the world. And we absolutely need to continue this awareness raising. Get tested. $42.95, I think, is a bowel test kit that you can order from Bowel Cancer Australia. It may be the very best $42 that you've ever spent. I'd also like to acknowledge we have another beautiful lady here, Sarah, and Sarah has just gone through her treatment for bowel cancer, and Sarah's in her 20s. So you are never too young. Continue to fight the good fight and have great health moving forward, and we are really proud of you. So thank you everyone for coming out. I'll hand back to you, Chris.
Thank you, Donna. Firstly, thank you, Jess, for telling your story and for telling Dean's story. Thank you to Jess's family who are here as well, and also Dean's family here as well. We know you've all been through quite a lot, and you know from personal experience how important it is to raise awareness and funds to tackle bowel cancer. With Donna, I also would like to acknowledge Sarah as well, who is, I think, a young ambassador for Bowel Cancer Australia as well, and diagnosed at the age of 29. And you getting out your story is really important as well. So thank you very much, and all the best on your journey, and everyone else who is going through that journey with bowel cancer or with family who might have bowel cancer as well. I'm not sure if you wanted to say any words, Sarah, at all, but but thank you once again for joining this. If anyone wants to join for the remaining 10 or so, I guess, kilometres of the walk to the bottom of Mount Martha, you're more than welcome, but please do donate. Hoping to get above $2,000. I think we're at about $1,600 last time I looked, but please donate towards this cause for Bowel Cancer Australia today as well, and thank you everyone.
Thank you. All right, that's right.
All right.
Chris has got 10 minutes before he's back on the track, so enjoy.
I'll have to empty the sand out of my shoes.
You might need a pit stop, Chris, before you get off again.
All right. Chris.
Thank you very much.
No worries, no worries, mate. Nice to meet you.
Yeah, same here.
Yep.
Same here.
What's your name?
Ian.
Ian, nice to meet you, Ian. And
this is Heather.
Heather, nice to meet you.
Yeah.
Nice to meet you. Thanks for coming along.
Thank you for what you're doing.
No, that's right. That's right. Wanted to raise the cause.
Raising awareness of it.
Yeah. Well, I thought, Donna's my chief of staff. She's Bowel Cancer Australia Ambassador. We can partner together and do something, and
that's great. No, it's
also
really
showcase
really
our coastline as well. So.
Yeah, exactly. So where have you walked from?
The top of Mount Eliza, so Kakaraboi Creek, where it meets Frankston South, and then we've walked all the way along to here, and then I'm going to go to the bottom of Mount Martha.